I clearly believe there are two critical areas that we're going to see, and it's my hope we'll see explode in a positive way for our patients in the future. And that, of course, is number one, more effective targeted therapies. Targeted therapies is kind of a very broad term, but basically being able to look at the molecular abnormalities, not just only DNA, but RNA, proteins, network abnormalities, finding the targets, maybe 1% of a population, but finding that abnormality, Achilles heel for that tumor, the driver mutation, whatever you want to use, finding the right drug or drugs. And when you do that, being able to follow the course of the illness in the blood, liquid tumor biopsies, and if you find changes, coming up with another drug. So clearly the targeted therapy era, which has been relevant, increasingly relevant in multiple other tumors, still in ovarian cancer and in all the GYN cancers, is behind, but we'll get there for the benefit of our patients. And the other big area, clearly, we are going to see is immunotherapy. And I had the opportunity in my career to be involved, you could say, in I won't say the new wave. At that point, we thought it was a new wave. It was the old wave. I was in the laboratory of immunology in the National Cancer Institute in the late 1970s, and we thought we would find the cure for cancer there. I was involved in some of the work we did with BCG and trying to modify tumor cells and give them back to patients, sort of vaccinations. And that was 30 years ago. And wow, it didn't work. The concept of immunotherapy was relevant long before that. It was relevant at the time, but we had no understanding of what we were doing. And that era passed with great disappointment because we really didn't understand. We didn't understand the biology. We certainly didn't have to understand that we didn't have the drugs, but that's changing, and it's changing very rapidly. Again, just beginning tantalizing evidence in the GYN space, both in ovarian cancer, and we're beginning to see some information in cervix cancer, presumably in endometrial cancer as well, where we're beginning to understand factors that might be relevant that we can stimulate or remove suppressors and essentially activate the innate immune system within the host to attack the cancer. Gross oversimplification of what's going on, but that's the general concept of immunotherapy.